Now we go to see the nurse protocols. So we see the guidelines for nurse protocols. The purpose of these guidelines is to provide direction, promote consistency, and support practice under nurse protocol by registered professional nurses in public health. Definition: nurse protocol means a written document mutually agreed upon and signed by a nurse and a licensed physician by which the physician delegates to that nurse the authority to perform certain medical acts pursuant to subsection. These acts shall include, without being limited to, the administering and ordering of any drug. So each registered professional nurse must have access to the current standard nurse protocols under which the RN is practicing at the practice site. Each registered nurse may have his or her individual set of standard nurse protocols which are signed by the nurse and the delegating physician. Order means to select a drug, medical treatment or diagnostic study through physician and delegation in accordance with the nurse protocol or a physician assistant job description. Ordering under such delegation shall not be constructed to be prescribing, which act can only be performed by the physician, nor shall ordering of the drug be constructed to authorize the issuance of a written prescription. You must have seen in the casualty and all, there are protocols where the nurse can do certain things. This is what the nursing protocol means. So the registered nurse shall write the drug order in accordance with the nurse protocol and based on a client assessment each time the drug is ordered. If the client continues the drug on subsequent visit, the nurse must reorder the drug based on the nurse protocol. Documentation of the written drug order by the RN shall be including the following components, which is the date ordered, generic name or actual brand name of the drug, strength of the drug, dose, dosage, route of administration, frequency, duration of therapy, quantity dispensed, and signature of the RN or APRN. Delegating physician. Delegating physician means the physician who has mutually agreed to and signed the nurse protocol. The district health director may be the delegating physician or one of the delegating physicians. The Department of Public Health recommends that each delegating physician be engaged in current clinical practice on a full-time or part-time basis. Legal signature. Entries into the patient's medical record must be dated and signed by the person responsible using full name and letters that denote professional title. Dispensing procedure means a written document signed by the licensed pharmacist and the licensed physician which establishes the appropriate manner under which the drugs may be dispensed pursuant to this code. Record review is a review of the client's clinical record of services provided. This may include reviewing the written summary or compilation of the record reviews conducted. Drugs to be covered by nurse protocol. Any drugs which the registered nurse orders and dispenses must be covered by the nurse protocol. Following drugs are to be covered by the nurse protocols. Dangerous drugs means any dangerous drug is defined as OCGA and 16 to 13 to 71 but does not include any controlled substance or Schedule 1 controlled substance. 2 dangerous drugs are required to bear upon the package words: caution, federal law prohibits dispensing without prescription, treatment only, or words like import. These drugs may also be referred to as legend drugs. Dangerous drugs are not to be stored in the nurse's home, car, or prohibited location. Drugs to be covered by either nurse protocol or policy procedure. Immunizations, vaccine immunization policies and procedures for the current allergy immunization program. For on-site public health clinics, those held at country health department sites, LPNRNs and APRNs administer vaccines under a district policy procedure based on immunization program. There should be a cover page signed by the district health director that references the immunization program manual has been accepted by the district to serve as either their official policies and procedures for the administration of vaccines and provision of immunization services, or a guide for writing the district immunization policies and procedures. For off-site settings, these settings that are not considered country department sites such as school-based clinics, RN administer vaccines under nurse protocol agreement. The RN should attach the nurse protocol signature. The RN who supervises the LPN who administers the vaccine does so under a protocol. The LPN does not sign the nurse protocol but administers vaccines. Over-the-counter, non-prescription drugs. The nurse protocol or policy and procedures covers drugs given to clients or called in to a pharmacy. These drugs include vitamins, oral iron preparations, acetaminophen, etc., which does not bear upon the package the words caution federal law prohibits dispensing without prescription or treatment only. Nurse protocol for the following situations. If the OTC drugs are repacked, that is taken out of the manufacturer's original container, such as a bottle of 100 tablets and or labeled in any manner or with any information different from the manufacturer's label, this must be covered by a nurse protocol. If the RN transmits the OTC drugs order to a licensed pharmacist who will provide the drug to the client, this must be covered by nurse protocol. District country policy and procedure on nurse protocol. If the OTC drugs are in the original manufacturer's container and no changes are made in the directions on the manufacturer's label, this may be covered by either district country policy and procedure or nurse protocol. No policy and procedure on nurse protocol needed if an OTC drug is recommended to the client by the RN but not given to the client or called into the pharmacy. It does not need to be covered by a policy, procedure or nurse protocol. Such recommendations should be documented in the client's medical record. Professional drug samples are forbidden in public health facilities unless a written district policy or procedure has been established to allow a licensed physician or a licensed pharmacist to request, receive and sign for professional drug samples and to distribute the professional drug samples to the patients. The written district policy or procedure must be approved by the State Office of Pharmacy.